In the U.S., there are still roughly 40,000 new cases of COVID-19 every day, and the leading American expert on infectious diseases, Dr. Anthony Fauci, is nervous about that. Fauci, who is on the White House coronavirus task force, would like that number to shrink to below 10,000 daily cases, and he's anxious about how Americans will behave over the Labor Day weekend. Fauci spoke to our Washington bureau chief, Jackson Proskow, who's with me now. Jackson.
Donna, like many scientists, Dr. Fauci worries that the worst is yet to come this fall and winter as a second wave of the virus coincides with the seasonal flu. And so I started by asking him about a new projection, a new COVID-19 model here in the U.S., which forecasts the number of deaths in this country could more than double between now and January to 410,000.
Well, it is a concern because, if you look at the background, the baseline of what we have, it's unacceptably high. So what you would have liked to see, like, for example, New York City metropolitan area got hit very badly. There was a period of time there where 50% of all of the cases and hospitalizations were coming out of the New York metropolitan area. But when they went up and peaked and came down, they are now at a very low baseline, like 1% or less positivity. But if you look at the country as a whole, our baseline is very, very high. And right now, it's about 30 to 40,000 or more cases per day. If we go into the fall with that high level of a baseline, then you add the risk of indoor activity because of the cooler weather, then we can have some significant problems.
I know a lot of Canadians are watching the situation down here in the U.S., and they're very worried about it. And there certainly doesn't seem to be a huge appetite, for example, for reopening the border. But I'm curious, your perspective as a medical expert, is there still a benefit in travel restrictions? Do they serve a purpose at this point in controlling the spread of the virus?
In some respects, it does. I mean, if you have an area, a country as a whole, or an area of the country with very, very low activity, obviously there's concern about letting people in from the outside, other countries in which there's a high rate of infection. Sometimes it does have a positive effect of keeping the lid on things, but sometimes, it just doesn't make that much difference. So there is always this argument as to the benefit or not of doing that. People will still argue on either side of that.
When we talk about a potential vaccine, and there seems to be optimism about maybe identifying a successful candidate by the fall, but can you put that in realistic terms? Yeah. What does that actually mean realistically for rolling out and mass distribution?
You can start thinking about the deployment of that vaccine at the end of the year, the beginning of the first quarter, the first half of 2021. And as we get well into 2021, there likely will be enough doses for everyone who needs it, because the companies are talking about pre-making ahead of time hundreds of millions of doses.
It almost feels like there's sort of two different message tracks out there right now. On one hand, there's a lot of hope about a vaccine perhaps being ready, at least by the fall, and advances in therapeutics. And on the other hand, fears of a second wave, for example, and the rising rates that you mentioned. And I'm curious if that confusion, if you worry that that's going to lead to a sense of complacency among the public.
We've been going through this stress and strain, everything from the economy to interruption of regular services to just the fatigue of having to be locked down to a greater or lesser degree. Ever since February and March, it's now September, and we're still in that boat. So I'm concerned that people are going to get so discouraged, they're going to loosen up the kinds of attention to public health measures which we need to continue to focus on if we're going to keep this under control.
And we know things are reopening on different timelines in places in Canada and the U.S. And so I asked Dr. Fauci if there's one thing he will refuse to do, even when he's allowed to. He said unequivocally he will not go into a bar even when they reopen. He said there's simply a bad idea no matter where you are, because as the drinks go down, the masks come off, and the social distancing pretty quickly disappears. Donna?
Okay, Jackson Proskow in Washington, thanks.
Whether reporting news from the field or anchoring it from the studio,
this is the first trade war.
She's been a trusted Canadian storyteller for more than 20 years. Global National with Robin Gill. Weekends on Global.